Hi there, it's FibroBear for FibroBearCares. I am speechless at the moment because medical misogyny is real, alive and active in Greater Manchester. I have just about every syndrome that someone with fibromyalgia can have. And so a couple of months ago, I went to see a doctor because my allergies were getting worse and things were getting triggering allergy symptoms. And I'm not just talking about rhinitis and sneezing and those type of things. I'm reacting to sunlight. I'm reacting to foodstuffs like pineapple, tomato, yeast. My GTN sets symptoms off, and it includes where my throat feels like it's closing and I'm having difficulty swallowing, all of these things. And I gave all of this information to my doctor because I'm querying mast cell activation, one of the many forms of mast cell activation, and it needs to be excluded, so I asked to be referred to an allergist. So today my surgery phones me and says that the allergy clinic has come back to them and said that it's allergic rhinitis without seeing me, and that they should just continue with the treatment as it is. Now, 2 nights ago, I reacted to yeast extract, where I thought I was going to have to call an ambulance because I was wheezing. I felt like my throat was closing. My SATs was dropping to 88, so it's not just in my head. I was coughing, vomiting. But this is rhinitis, obviously. I react to the sun, I react to motion in motor vehicles, everything. It's your classic mast cell activation. Now, what do I base that on? Well, as some of you will know, I was a registered nurse. The clearest indication for me is that I've had these allergy symptoms for years, and it responds to antihistamines, which is one of the criteria for mast cell activation, but it doesn't show up in my bloods, which is another criteria for mast cell activation. But obviously it's allergic rhinitis. I am so miffed, I could scream. So the poor person who was asked to phone me, which was not a GP, about this letter back from the allergy clinic, got it both barrels. And she kept saying to me that the clinic would know better than I would, and I corrected her on that point, because between the two of us, I think I know that clinics can make mistakes. So, very angry, very cross. And the thing is, she kept pushing me off, saying, well, the clinic, they won't accept a re-referral, they won't do this, they won't do that. And I know my rights under the NHS Constitution. I can ask for a second opinion. I can ask for a re-referral. I can ask for a reconsideration of a decision like this. So, if this is the type of responses that patients who don't know their right gets, then the NHS is in even a worse state than I think. And it is an absolute crying shame, and it needs to be fixed. And it won't be fixed by more managers or by imposing fines from above. We need more nurses, we need more doctors, and we need better training. And we don't need GPs asking poor receptionists to phone patients. Rant over.